let me talk to you a little bit about insurance. You have 3 risks on insurance when you go to the United States. The first is who's going to pay for the prenatal and delivery expense. Okay. The second, if the surrogate has complications herself, if she hemorrhages or the uterus follows the placenta out or she needs a hysterectomy, who pays for that? And as an international couple, your Swedish insurance is not likely going to pay for the cost of caring for your twins in the United States. And it's difficult, if not impossible, I put it at impossible, to get any insurance to cover that. So if you have twins that are in the hospital for a month and you have a $100,000 bill, who's going to pay that? Insurance companies in the United States are not like nationalized health insurance. They're private companies. Every company drafts its own contract based on its own terms. So all insurance contracts are different. They're not all the same. About 2/3 of the contracts have language in it that says we will not pay for a surrogate pregnancy. Half of those mean they will not pay for the woman they cover if she's pregnant as a surrogate. The other half mean we will not pay you to hire a surrogate and pay her costs. And you need to know the difference. The other third don't have an exclusion at all, which means they will pay for the maternity and delivery expenses and the complications. The postnatal coverage, which is really your most dangerous risk because of Dr. Doyle's success in having twins and because the possibility that they may come early, is the tricky part. And that's not covered by the surrogacy exclusion, that's covered by the definition of an eligible dependent. So in the United States, if you as an adult have a child that's yours, you get to add that child onto your insurance and your insurance will cover the child. So if you do a surrogacy and at the moment of birth, the child remains the child of the surrogate, and under her policy, that's defined as her child. Her policy will cover the children in the hospital, okay? Think about that. So if you go to a state where there's pre-birth orders, and the pre-birth order says that child is yours immediately on delivery, a pre-birth order sounds like a really good idea because you're the parent right as soon as the child is born. That means you can't use the surrogate's insurance and you're going to have to pay out of pocket if something very expensive happens. If you go to states where you get post-birth orders, so the legal parentage doesn't change until after they're discharged, then you can add the children onto the surrogate's policy. It's a very complex area, and it's another place where the U.S. attorney becomes very, very important to understand and help you analyze that risk. Because if you're a millionaire and you don't care how much it costs, you're not going to care. But if you're like me and you're just an average person, you probably can't pay a $200,000 hospital bill out of your assets after going through surrogacy. So, very important issue.
And let me just mention that this is one of those cases where you want to get several opinions. Some agencies will tell you, you can do this, you cannot do that. The only thing I would keep in mind is that some agencies also own, or part own, or married to somebody who owns the insurance company. So I would therefore be, factoring it into your decision making, because some of them will tell you, and you can believe them, we're not unaffiliated with anything, and we think, in our best legal opinion, you should not, try to get the surrogate's insurance cover the newborn. That's a legitimate something to say.
Yep.
But find out whether there might be a reason why they're saying that and why they're trying to sell you policies that could be the upwards of $20,000 or more that will also not cover twins. So many times they will tell you you cannot even attempt to have 2 embryos transferred because there are no policies that will cover twins.
Yeah, every agency in California will tell you you can't use the surrogate's insurance policy because they have pre-birth orders and you become the parent upon birth. The answer to that question is different in every state. So if anyone tells you that the answer they give you applies all over the United States, that's your first sign that they're not giving you all the information.
Who should guide you to the insurance company? Is that the agency's job?
It is the agency's job, but as I said, various agencies have various different protocols about that. Some agencies would like to find the surrogates just in the state where, or primarily, or very strongly primarily, in the state where they're located. And if that state is a state that has more complicated insurance situation, then their answer is going to be, forget it, it's just impossible, don't even think. You know, other agencies, that is a very first sign, a good sign that you might want to get another opinion. You know, some people here, you know, would rather go the most perhaps secure way of buying every additional insurance you can. I mean, if you can afford it, that's fine. But as we said before, there shouldn't be a point where you feel that the only way for you to do it safely and ethically is by spending $140,000, $150,000, $160,000. That is not the case.
Yeah. And that's another reason to go back to knowing at the very beginning what all your options are and defining your long and short-term goals, because depending on what they are, especially on this issue of twins, you may be very wise to pick a surrogate from a specific state, anticipating some of these issues, that, or a surrogate, maybe when I review records, I may see, well, she had 4 babies, and they were all born 2 or 3 weeks early, but they were all fine. I would approve that carrier for only a single embryo transfer, because when there's one baby in there, everything's consistently, but I wouldn't push the luck on someone like that and approve her for twins. So there's a lot of communication between the lawyers and the doctors and the best agencies that are specific for these people from this country with these obstetrical and family building goals. This carrier makes much more sense than that one. And so particularly,
the biggest takeaway is regardless of what country you go to or where you go, you need to be an educated consumer, and somebody needs to teach you the questions to ask. If you ask the right questions, it can be a reliable process. The ethical nature of it will vary from country to country and circumstance to circumstance. But I will tell you this, cost should not deter you from the United States. It isn't a fact that every surrogacy in the United States costs $150,000. That's a myth. It does with some agencies. The West Coast tends to be the most expensive. The East Coast tends to be slightly less. And other parts of the country, particularly in the Midwest, are less than that. So Ron has a website and a survey of customers from various agencies, I think 10 or 12 or 14 from around the country. You can go on there and look at the costs for U.S. surrogacy versus some other options. And I will tell you that when you go there, you will see that some of the agencies can do a complete surrogacy with all expenses included for under $90,000, $85,000 to $90,000. The difference between that and the cost in some other countries is not the same as $150,000 to that. So do your homework, use the information that Ron is compiling, make educated decisions, and then balance your ethical requirements versus your cost requirements.
To be fair, it is not, you know, scientific or, you know, research yet, and the sample may not be large enough, but patterns do emerge. And obviously the things that might affect it sometimes are, you know, people report about a sibling journey which is less expensive, or people report about traditional surrogacy, but they are still the small minority because we asked that question. The differences have to do with insurance. That's a huge difference. Insurance can account to about $20,000, $25,000 sometimes. The other difference is a surrogacy agency fee, or the hidden cost. There are a lot of hidden costs in the medical process. The medical process, many clinics would give you a package deal that would have supposedly, you know, a flat fee for several tries, but the cost of the egg donation will not be included, or specifically the egg donation if you need an additional cycle, and that could run, you know, another $10,000, $12,000 sometimes if you need another fresh donor. So people. And obviously people may also decide to go sometimes for a very expensive, out of the standards egg donor. And I do know people who spend more than $20,000 on an egg donation, or some sort of specialty agency that doesn't follow the US norms. So those are the things that And then let me also be frank, there are people who are very specific about the design of their family. They want to have one child per father, let's say, and then, you know, they do a cycle, and the eggs of one, the eggs that were fertilized with the sperm of one father did not yield enough embryos, and they go for another cycle because they really, you know, so there are all kind of things.
Or gender selection.
Or gender selection.
Make sure there's a boy and a girl. Or
so I'm saying those things could affect some things. Some clinics, you know, but I'm saying the things that are more across the board. Did I miss some components?
No, I think you're accurate. Here are the places where you're going to be able to exercise control and not exercise control. The first is, how much, if you're going to use an agency, what's the cost of the agency fee? And what does it include? If you pick this agency, that's a $13,000 swing. That separates it, okay? So you got to know what that cost is. The second thing that will affect it is your surrogate's fee. Every surrogate charges a different fee. There isn't a flat fee for surrogates. Some charge $45,000, some charge $15,000. This is under your control. This is under your control. You can pick a surrogate with a lower fee.
But most agencies would abide by the
They'll
norm.
Well, there aren't really any norms published by the ASRM like there are for egg donors.
But I thought the norm was about 25 or 28,000. What is the
It
norm?
depends on whether you're on the West Coast, the East Coast, or in the Midwest. It varies. So
It
that's
is
another
true.
issue.
It is true that some agencies or many agencies will tell you that you need to pay a premium for a
Second time
surrogate, an experienced surrogate. And I think, from what all I've heard in all the workshops and seminars I sat through, the advantages of using an experienced surrogate are not nearly the same as the advantages of using an experienced or a proven donor.
Correct.
It's almost the reverse. With an experienced surrogate, you're getting somebody who might not be willing to do it for you in another time if you want a sibling journey. She may actually be doing increasingly worse medically over time, or might have, you know, and so the reason to pay a premium for an experienced surrogate, I don't think they really, it's warranted. Whereas for an experienced donor, maybe you want to talk about, because that's also a way to save costs. If you want to, instead of choosing the right, you know, eye color and height or whatever, if you want to really be focused on the success within the range, then use a donor.
Right, well, particularly if you're going to lower your cost, because again, it's like a restaurant. What does dinner cost? It's, well, what do you order? I mean, if you're choosing a shared donor cycle and you can save $10,000 or $15,000. And again, that's why I think the survey, you know, you don't know what any of these people did to get to where they got to, and that's part of the range. But you can make very active choices as long as they don't diminish the impact that you're trying to have and lower your pregnancy rate and reduce the medical costs. If you're working in a clinic that we guarantee 20 eggs, because we have a frozen egg bank. So if your donor doesn't produce 20 eggs and you need more eggs, then we give you those eggs either from that donor or a different donor for free. Because again, you're not the idea. What the idea of going back to the well repeatedly and paying for second and third egg donations is impossible to quantitate at the beginning, and that's one of the hugest hidden medical costs. Just like the one Steve's going to tell us, but there's other legal hidden costs as well.
Yeah.
But then just one more thing about it. Some people get carried away, and I see it in my group all the time. Initially they say, okay, we can adopt a child, in which case they would have known nothing about the genetics of that child. But then once they finally do a surrogacy, some people get, you know, they feel like they're in the candy store. Like, why not a little taller? Why not a little, you know, more, you know, music maybe, humor, all kind of things. And at the end of the day, that may be terrific, but the doctor may tell him, you know, if you choose this donor, she's experienced, and we know that you're going to get more eggs.
Done 4 donations.
And you know, we know the success rates, but they'll say, she looks exactly like my aunt and whatever. And at the end of the day, that may make it more expensive. I mean, if it's fine with you and if it's okay, then by all means. Some people, you know, we did it, use a family member. It's great as an egg donor. Realize that if she's not medically optimized, it might take you several tries. As long as you're informed, I guess.
Mm-hmm.
That's right.
Yep. So here's the swing. How much does your agency cost? What is the surrogate charge? What kind of insurance does she have? Because that will affect how much of the medical costs you're picking. What is your clinic's charge and program? Not all clinics have the variety to adjust your cost that Dr. Doyle has. Some of them just do a straight IVF fee and it's extremely expensive. And then how many cycles do you have to go through? How many donor cycles do you have to go through and how many transfers? That affects it. These 5 right here, they're all under your control. You know before you pick your agency, before you pick your surrogate what these are, and before you pick your clinic what it's going to cost. So you will be able to customize the cost of your program between $85 and $150 by making educated decisions about how much your budget will take. And if you want to make sure you pick the least expensive agency, wait for a surrogate with a low fee with good insurance, and take a shared cycle to reduce costs at a responsible clinic, you're toward the $85,000 range. The only thing you can't control is this piece down here, how many cycles it's going to take, because that's not predictable. Although it's pretty predictable if you have a 75 or 80% pregnancy rate.
You can try by asking for, by putting primacy over the how proven the donor is versus qualities, and especially clinics do have sometimes ways to cap or control the cost.
It just doesn't always behave the way we expect it to. And if your egg donor, I mean, very rarely, has a personal or medical issue that prevents her from even donating at all. I mean, you've already flown over there, your surrogate's been on medications. Can you imagine the week before the retrieval, them saying, well, the retrieval's been canceled. Or even if the donation occurs and there just aren't that many eggs, or for some reason they're not that good, it's very cost effective to have the option and ability to say, if you can toggle, if you can handle this dramatic shift emotionally away from the donor that you had identified and choose another one in the next couple of days, the surrogate can still arrive. We can either use frozen eggs, which we thaw, with the same success of fertilization and pregnancy as fresh, at over 50 babies now with frozen eggs. Or I may have a donor coming through this week and next week who we're just freezing all her eggs. So those eggs can go to you. We just won't freeze them. We'll freeze them another time. So the ability to toggle, I mean, it has to exist as an option, but it also has to be an option that you can navigate yourselves emotionally. And I think you're right. It's just not only way easier to continue, but far more inexpensive than just telling the surrogate, well, we'll reconvene in a few months and start all over. So, yeah.
And just for the record, this is not available in 99% of the clinics now. So the ability to not have to cancel cycles at the last minute, for a variety of reasons, each one of them is a small percentage, but they can add up to an X number of, I don't know what would be the assessment, how many people cancel cycles.
I visited Dr. Doyle's clinic as an agency just to determine whether we wanted to work with his clinic, and the variety and nature and his commitment to trying to make it cost accessible, I haven't found anywhere else, and I've talked to a lot of clinics.
I'm saying if you don't need to cancel a cycle, then you are saving a lot of money by basically being able to continue with that cycle. So back to your original question, the ups and downs that cannot be controlled, the last item there that is out of the control, rectangle. This adds another element of control.
Yeah.